Hello, my name is Matthew Rogers, and I'm completing this physical head-to-toe assessment for my Health Assessment 2 class at UNLR. Whenever we would start out a physical exam, we would start with washing our hands, introducing ourselves to the patient, and then taking that patient's vital signs, their respiratory rate, heart rate, blood pressure, O2 saturations, and their pain level, as well as their temperature. The next thing we would do is we start with the skin. We just examine all of the skin. Is there any masses, any scars, any tenderness anywhere, any discolorations? We'd also examine the moisture, texture, and again for any tenderness that might be there. Next we move on to the hair and scalp. We're looking for any missing strands of hair, looking at the scalp for the texture. Is it smooth? Is it moist? Is there dandruff there? Things like that. Next we would look at the nail beds. Are they pink? Check cap refill. Is there any deformities in them? Which hairs are all normal. Next thing we would do is we would inspect the head and neck. And whenever you inspect the head and neck, you're looking for normal position of the head, which hers is good. All the facial features, her facial expression, she has a flat defect, the size of her head, everything's normal obviously. There's no scars or anything on the skin of the head or neck that's abnormal. Next thing we do is we palpate the trachea. To do that, you just have the patient extend their head just a little bit forward. You're looking for any deviated parts of the trachea, and you would also palpate the thyroid for any enlargement there. Next thing we do is we would do the lymph nodes. You have 10 chains. You turn your head that way. Pre-auricular, post-auricular, tonsillar, submandibular, submental, occipital in the back of the head, pre-cervical, post-cervical, supraclavicular, and the deep lymphatic chain down there. Next thing we would do is the cranial nerves 5 and 7, the trigeminal and the facial. We would just ask the patient to smile big, stick your tongue out, and then can you feel that retouching? Good deal. Alright, so her cranial nerves 5 and 7 are intact. Next thing we do is inspect the eyes. Are they symmetrical? Is there any kind of deformities? No. Her conjunctiva, sclera, iris, they're all intact. Eyelids, eyelashes, eyebrows are all there as well. Next thing we do is the pupils. Hers are about 4 millimeters right now, and they're round, and then we test the light accommodation. So we just examine each one, make sure that they decrease or shrink as well, and which they do. And then we'll ask her to follow the point of the pin up, down, around. Alright, then we use the ophthalmoscope, which I don't have one, so I'm going to use this pin, and you would just shine the light through the pupil itself, looking for the optic disc as well as the red reflex in both eyes bilaterally. Since we did that, we actually tested the cranial nerve 2, 3, 6, which is the optic, oculomotor number 3, and abducens number 6. The next thing we move on to is the ears. We would inspect the tragus and mastoid, palpate it for any tenderness, look for any discharge obviously, and then any deformities that are symmetrical bilaterally. Then we're going to use, now we're going to test the cranial nerve 8, which is the whisper test. So I'll just whisper something in her ear. Okay, so that's intact. And then we're going to do the Ryan and Weber test. The Ryan test is use the tuning fork. I don't have one of those, so I'm just going to use my pen line for that as well. You'd hit it against the table, put it up against the mastoid. You can look that way, so put it up against the mastoid. And then whenever she stops hearing that noise, you're going to set it on her shoulder, and then she's going to tell you whenever that stops, she stops hearing that. Your air conduction, which is out here, should be greater than what she heard at bone conduction. And then for the Weber test, you're going to hit it on the table again, put it on top of her head, and she's going to tell you which side she hears the most noise on, and it should be equally on both sides. Next thing we're going to use is the otoscope. The otoscope, you're going to look into the ear to see the tympanic membrane, and you're going to pull the pin up and back. So kind of look that way, don't have an otoscope either. And you're looking for the light pink and kind of a translucent tympanic membrane on both sides. Next thing we're going to do is inspect the nose. You're going to look for any asymmetrical features, any deformities, which there's none. Oral or the mucosa, make sure it's pink, and make sure that the septum, you can look back. Septum is midline and everything. Then we're going to palpate the frontal and maxillary sinuses. Frontal up here, maxillary, any tenderness. So there's no tenderness there, no inflammation. Now we're going to assess the patency of the nares. So if you can breathe in, and then breathe in and out. So they're both patent. Cranial nerve 1, which is our olfactory nerve. Close your eyes, take a big whiff. What do you smell?
Coffee.
Okay, so cranial nerve 1 is intact. And now we're going to inspect the mouth. So you just have the patient open the mouth, and then you look in, look at the gums, the teeth. There's good dentition there. There's no gingivitis. The tongue is pink, and oral mucosa is pink as well. The pharynx, the hard and soft palate. You look for the uvula and the tongue, and then she has no tonsils because she had a tonsillectomy. So then we move on to cranial nerve 9, and 9, 10, and 12, which is the 12, the hypoglossal. She did forest nerve, she stuck her tongue out. The glossopharyngeal and the vagus, we have her taste something. I don't have anything for her to taste. But then her talking test does as well. Those are all intact. The next part would be the inspection of the breast. We move on down. You look for the skin. Is there any discolorations? Any discharge from the nipples? Any the contour? Make sure that everything's symmetrical. You'd also palpate the axilla nodes, and you're going to also palpate the breast for any masses or tenderness. The next, we move on to the thorax. We're going to examine the thorax anterior and posteriorly. You're going to just kind of listen for the rate and rhythm of breathing, the depth. Is everything symmetrical whenever she breathes? The presence of any retractions. Is she in any kind of distress whatsoever? She's obviously not. You would also palpate the thorax as well, checking for any tenderness or masses there. Once you've done that, then we can go on and palpate for tactile foraminus, which is a vibration that's heard during vocalizations anytime she's talking, and you just can kind of feel around for that. Chest expansion, you're going to palpate for that, make sure everything is symmetrical in every way. Next thing we do is we percuss the lungs. So you just take your finger and just kind of nail down a little bit over here, and the sound should be resonant as well. The next thing we're going to do is we're going to auscultate the lungs with this one. You would do this anteriorly and posteriorly as well, and all those, the right side is going to have 3 lobes and the left is going to have 2. And you're going to have her take a deep breath, in and out, and you're going to listen to each of these lobes bilaterally for 1 full inspiration and 1 full expiration. And you're going to do that on the anterior and posterior side as well. The next, we move on to the cardiovascular system. Initially, we're going to look for calf refill in the toes and fingers, make sure everything's less than 3 seconds there. Look for any edema, and if there's any varices in the veins or the legs or anything. Next thing we do is palpate all of our peripheral pulses. We start with the brachioradialis, which is up here, the radial pulse right here, palpate the femoral, the popliteal, the dorsalis pedis, and the posterior tibial pulse down there. We do that bilaterally, making sure that those are all strong. Then we would auscultate the carotid pulses, or we palpate them first on both sides, carotid pulses. Do them one at a time, and then we're going to listen with a bell of the stethoscope to check for any carotid bruits as well there. The next thing we're going to do is we're going to auscultate heart and lung sounds. So you would check the aortic, then come on down to the pulmonic valve, the tricuspid valve, and then the mitral or bicuspid valve down there. And you're listening for any murmurs, any S1, S2 heart sounds, any kind of abnormal findings there. Hers is all normal, we heard S1, S2. Next thing we have to do is have the patient lay down on the exam table. And the first thing you're going to do is just look at the symmetry and the contour of the abdomen itself. We're going to check for any obvious signs of deformities or anything. The next thing we're going to do is auscultate. You're going to auscultate in all 4 quadrants, upper and lower quadrants, listening for vowel sounds. If vowel sounds something happens and they're absent, you have to listen in each quadrant for 5 minutes. That would be a total of a 20-minute assessment if your vowel sounds are absent from each of the quadrants. The next thing we can do is percuss, and we can heard a resonant sound there. And then the next thing we do is palpate easily, and you're going to palpate for any organ enlargement, any masses, and any tenderness in the abdomen as well. Alright, the next thing we're going to do is work on the LOC, or level of consciousness. This patient's awake, alert, oriented, and orients a person, place, and time. Obviously, we would have tested her remote and recent memory, just by asking her to remember a simple phrase or something. Cranial nerve 11 is your accessory muscle, so all we do there is have the patient push up with their shoulders, that accessory muscle nerve is there. Deep tendon reflexes would be next. We do the brachioradialis reflex, just kind of relax your hand and just check it, and you should see a reaction up here. And then the patellar is going to be down here. You can do it with that. You're really supposed to use a reflex anywhere, but I didn't have one. And they're 2+. We'd ask her to stand up at this point. And we would notice her gait and posture. She has a normal gait and her posture is normal as well. Her joints, we'd ask her if she's had any tenderness, any pain in any joints, and we'd actually inspect them for any redness and signs of inflammation from her joints as well. If you have any. Alright, and then the next one is the assessment of the spine. And we would do a flexion, which is going to be bent forward, extension, a rotating, and then shoulder to the side. That's lateral bending, but we'll do the shoulder. Okay, that's fine. And then we would move on to our shoulders, and we do abduction, flexion, extension, abduction, adduction, internal and external rotation, which you can just extend it out, go up, down, we're going to come this way, back behind the shoulder, and then we're going to make a stop light and then go back as far as we can. Alright? Yep. The next is going to be the elbow, and just to test the elbow, we're going to flexion, extension, kind of do your palm. That's supination, and then pronation, just like that. And then the wrist and hand would be the same way, flexion, extension, and then your adduction and your abduction right there. And then the hand, just spread it out now. Now the hip's a little more difficult. You'd actually have the patient lay down for this. Have the patient lay down. But for the hip, we're going to do, kind of just kick your leg up, back, behind you, and then to you. So that's adduction, then extension, and rotate it inward and outward. And you would do that for the knee as well as the ankle and the feet. So, the next thing we would do, last but not least, is we're going to test the muscle strength. So if you'll just squeeze my hands, start it again, and then if you'll set back down, versus there, and push up with your knees, and push up with your feet. Alright, that completes our head to toe physical assessment. If you have any questions, just let me know.